Welcome to Understanding CK Levels. This section is entitled Interpreting Creatine Kinase Levels in the Clinic. Parent Project Muscular Dystrophy is grateful to have this education provided by Dr. Russell Butterfield. Dr. Butterfield is a pediatric neurologist providing clinical care at several institutions in Utah, including the University of Utah, Primary Children's Hospital, and Shriners Children's. He specializes in neuromuscular disorders, including Duchenne and Becker muscular dystrophy, with a research focus in genetics and genetic therapies.
It's good to be with you.
Yeah, thank you for being with us. Our first question, how do you use CK levels in your clinic?
Well, the CK levels are really a first pass look at any indication that there might be breakdown in the muscle in a patient that comes to clinic. So usually in our first visit, if there's a sign of muscle weakness or developmental delays, you would probably go home with a lab order for checking the CK level. That level indicates any number of different possible diagnoses that could be related to muscle breakdown, but as a good screening tool and can be done cheaply and easily in any clinic.
As a follow-up question, how do you think of the results, or how do you use the results when they come back? What are you looking for, or how are you using that to guide what you do next?
In terms of muscular dystrophy, we're often suspecting muscular dystrophy just by the clinical scenario, and the CK level can be a good confirmation of those suspicions. And for Duchenne muscular dystrophy or even Becker muscular dystrophy, the CK levels are be really, really high. So in most cases, the level in a normal person is around 150, and you might have 5 or 10 or 15,000 or even higher in a patient with muscular dystrophy. So it's usually not a subtle change in the CK level, and that points us to the next step in testing, which is usually a genetic test right from the very start of the evaluation.
Okay. For a person who, in general, you're suspecting they may have Duchenne or Becker based on their exam, their genetic test results, other things that have been part of their evaluation. When you're thinking already that they could have Duchenne or Becker, is there a level or a threshold of CK result that can tell you for sure if it's one or the other, or that helps you decide if it's one or the other?
I would never trust a CK level to point me in a direction of Duchenne versus Becker. They probably are a little lower in Becker patients, but they can vary so much between individuals. I would never venture a guess on Duchenne or Becker, even some other muscular dystrophy without additional, usually genetic testing to clarify what's going on.
If someone gets back a very high CK level, does it automatically mean that a certain thing will happen in their future as far as what it means for their long-term mobility? Is there an automatic thing that a CK level means?
There's nothing automatic in any of these things. And in even, just in terms of muscular dystrophy, which is a high CK doesn't mean that you have muscular dystrophy. There could be other reasons to have a high CK. So from the start, those need to be evaluated and looked at. And even in the case that they do reflect muscular dystrophy, the potential for care is changing every day. And we have new medicines. We have things I never dreamed of a decade ago when I started doing this. Um, and so the future will still be written. We can't predict that.
Can a child who has had multiple normal CK levels go on to develop Duchenne? Is that possible or expected?
It would be really unusual for something like that to happen. While it's not very specific for the type of muscular dystrophy, it's usually very high level in a patient who does have muscular dystrophy. And patients who've had a normal CK level especially multiple times a normal CK level would be very unlikely to be expected to develop muscular dystrophy in the future.
If a person has a normal CK, we've talked about if there's multiple normals in childhood, we don't think of that expectation as them going on to develop muscular dystrophy. But does having a normal CK eliminate the risk of future symptoms?
I think a person with a normal CK, say in a setting where they've had a genetic test that identified a variant, it probably rules out Duchenne muscular dystrophy and Becker muscular dystrophy, especially if they've had a normal CK on multiple occasions. In some cases, the variants in a gene are benign, and so they require some interpretation, usually with the help of a neuromuscular specialist or a genetic counselor familiar with the DMD gene. So I think in combination with a normal CK and a well-verified genetic report, that you can most likely eliminate the possibility of Duchenne or Becker.
What about using CK to understand whether someone is a carrier, a female carrier, or how we, call a heterozygous carrier? Can we use CK to know who is a carrier?
No, CK is not a very good way at all to tell who's a carrier. Some patients, some females who are carriers can have mild elevations in their CK levels, but you would never rule out a carrier using a CK level since they can be normal in many carrier female patients. Um, in a female who has a known genetic mutation in the DMD gene and a high CK level, that may reflect the possibility of someone being a manifesting carrier. So the CK level should point neuromuscular specialists or others to be more attentive to that possibility. But it couldn't rule out a normal CK level, couldn't rule out someone being a carrier.
What advice do you have for someone who has a CK result that they don't understand? They were given a report or told a number and they're confused.
I think the best thing is to ask your doctor to help understand the results. And if that was done by your primary care doctor, start there. Sometimes they will know or not know, but they can take that question to a specialist, or you can take that question to a specialist, neuromuscular specialist, if if there's still questions after that. It can be a little tricky to interpret CK levels, so I think getting that specialist input can be really important.
Is there anything else that you think is important for families to know or even, primary care providers to know or understand about CK levels?
I think the most important thing is to actually just to check it. One of our biggest frustrations in the neuromuscular clinic is when a patient's had developmental delays that have been ongoing for a few years, but didn't get diagnosed for whatever reason. And a CK is just a really good way to screen for the possibility of muscular dystrophy in any child who has motor delays, especially. So I think that's probably the biggest point to emphasize is just to check it and probably check it often, um, so that we can catch these kids earlier in the course of their disease.